Hello, welcome again to the Eating Disorder Hope Virtual Conference, Anorexia, Hope and Healing in 2018. I am delighted to introduce our next presenter, Nicole Karst, who will be presenting on who I am without anorexia. And a little bit about Nicole. She has 17 years of combined experience in the health and mental health fields. After completing her service in the military as a Fleet Marine Force Corpsman, she started a career in nursing. It was through her nursing experience that she began working with those diagnosed with eating disorders, substance use disorders, psychotic disorders, and mood disorders. This experience inspired Nicole to return to school, and she is graduating this spring with a doctoral degree in clinical forensic psychology. Nicole's experience includes individual and group therapy, psychodiagnostic assessments, mindfulness meditation, medical assessing and monitoring of complications related to eating disorders. So we are really delighted to have you here, and I know everyone will be so inspired and encouraged by this. With that, I'd like to hand it over to Nicole.
Thank you so much. I really appreciate everybody's time and attention. And today I'm going to be talking about how to help people find purpose and meaning in their lives, and also their truest self in recovery apart from anorexia. And some of the objectives that I've identified that we're going to try to hit today are really exploring anorexia as an identity, or even a higher power at times. In the midst of an eating disorder, people become very identified with it. So we're going to kind of parse that out a bit. And then one of the things that can happen when you bring a person into recovery is they can then become very over-identified with a diagnosis. So as practitioners, we do have to be very mindful that that is not happening, that they're not letting go of maybe the behaviors that they were identifying with or the thinness that they were identifying with in exchange for really identifying with a label, a diagnosis, or so forth. And one of the ways that we do this in treatment is helping people distinguish between a true self and a false self. So we're going to go a bit into that and what that means. We're also going to look into how codependency and really losing oneself in another person can play a part in the identity of a person struggling with anorexia. And then we're also going to talk about what to do about that and how setting really clear boundaries can help people have the space to be who they truly are. And then really also gaining an understanding of what it takes to cultivate a truer sense of self in recovery. One of the questions I frequently ask anybody that I'm working with is, who are you? And I encourage them to ask themselves that periodically throughout the course of treatment and even throughout the course of their entire lives. One of the things that can happen is they can develop a pseudo self or a false self. And that's something that we want to make sure we help them understand. So here at Rebecca's house, one of the things that we do is we help people identify a false sense of self in the interest of discovering who their true self really is. And one of the things to keep in mind, whether you're a practitioner or a loved one of a person who's struggling with anorexia, is the battle that's happening between the false self and the true self is truly exhausting for the person who is fighting that battle. And it's important that we don't allow ourselves to really personalize what's going on when maybe they're living from a false sense of self or a pseudo self that has become honestly very familiar to them. And oftentimes in early treatment, when I'm first starting to build a relationship with somebody who's asking for help, is that false self doesn't feel false at all. And in fact, I would never tell them that they're being false or bad or anything along those lines. Instead, I would help them explore who it is that they think they are. And then from there, launching from, well, is that something you'd like to continue? So it's very much about asking questions rather than telling somebody who they are or who they ought to be. And there's a very fine line. So I just kind of a word of caution on that. And as one's departing from this false sense of self, we don't want people feeling like they're floundering either. It's really important that you give somebody something to grab onto when you're asking them to let go of something else. So simply to say, don't do that, don't behave that way, just eat something. That's not entirely fair, because if you're telling somebody not to do something, what you're not telling them is what they ought to be doing instead. And really, the codependency can really impair their ability to know who they are, because they are simply behaving in a way that they think will be approved by others. And this can also happen in the therapeutic relationship as well. So for those of you who are practitioners or clinicians that are watching this webinar, please be very mindful to have a nice and clear distinction between who they are and who you're telling them to be necessarily, or rather working really hard not to tell them who they should be, but rather asking them who they would like to be. And again, really creating space for people to be who they are. One of the things that comes to mind while I'm talking about this is a common turn of phrase is, do you know what I mean? You get what I'm saying. And very rarely will I let that lie, and I'll say, well, why don't you tell me what you mean, rather than me inferring what it is that they mean. So there's these small opportunities throughout the course of the therapeutic dyad, or even throughout the course of a conversation with somebody that you love, where you can give them an opportunity to have their own voice, rather than simply assuming what it is that they mean. So please take those opportunities, ask those questions, and that's how you can create that space for them, where you're not inferring or telling them who they ought to be, but rather you're allowing them to explore who they would like to be. To give the context and an understanding of anorexia and a person's identity in relation to anorexia, I think it's really important to consider the historical context of extreme starvation. Carl Jung is one of the founders of the idea of psychodynamic psychotherapy, and he talks a lot about the collective unconscious, and kind of a quick way of talking about that is it's the kind of pool of consciousness from which we all draw from, and we can understand what's within the collective unconscious by looking at historical events surrounding any one issue. So that's what I'm hoping we can do today. So when we look back into the history of anorexia, we can trace it back to the 15th century, when women were really trying to find power, and one of the ways they could do that was by being sainted within the Catholic Church. And this is when we saw holy anorexia. And there's lots of books out there on this area that you're welcome to look into. There's lots of good literature out there on it. But just to kind of touch on that, just thinking about the context of power, and that traditionally women were in a patriarchal society, and this was one way that they were able to be their own person in a sense, and that they were able to have the power to not have to enter into a marriage. So this is where it started. If I'm able to starve myself, I'm able to have power over my life and over my decisions. And then we move into the 15th and 16th century, when extraordinary fasting was no longer considered a trait of a saint, but rather it's being seen as witchcraft or even demonic possession. And so you can imagine the kind of shame and embarrassment that can come alongside of that for those women that were suffering that at those times. And it wasn't even until the 16th century, until the kind of 18th century, that we started to transition into more of a medical model in understanding the idea of anorexia. And then in the 19th century, we see people finding power through hunger strikes. And it's important to consider this entire context, because it's not that different from what's happening now. A lot of times when I've worked with people struggling with anorexia, they take a kind of pride in the self-discipline of restricting behavior. And we're going to get a little bit more into that later on another slide. But also in the spirit of understanding the identification with it, the spiritual identification can be that, this is something that is revered, and considering the historical context of it. So some have looked at anorexia as a kind of spiritual hunger, that it's almost a substitute. There's different books out there talking about how anorexia is revered as a higher power even. And so we want to make sure that we're taking these things into account, because when you ask somebody to simply stop starving themselves and stop engaging in eating disorder behavior, you're really asking them to take away a large part of their identity, and maybe even a sense of a higher power or something to live for. This is just a very basic kind of outline of the diagnostic criteria for anorexia. Restriction of energy and resulting in a low weight. People pretty much understand that. The intense fear of gaining weight, or persistent behavior that interferes with weight gain. And I wanted to pause here on this criteria in particular, because this is that battle that I talked about earlier. And the battle that I've seen is I will be sitting with somebody who's severely thin and telling me they want to gain weight, that they understand that their weight is too low, that they don't even like the way that their body looks at this weight, yet they continue to engage in behavior that interferes with weight gain. So that's something to really distinguish, because that's a perfect illustration of that battle. Even though they're thinking something and wanting change and wanting to get better and telling you that, they may not be able to carry that through into action. So it's really important that we take a moment to appreciate that and not personalize that, and just take the time to talk with a person about what's keeping them from taking that next step into action. Disturbance in the way the body is experienced, and undue influence of the body on self-evaluation. And again, I'm going to pause right there. Self-evaluation, the body becomes the kind of foundation of self-worth, which is really important in considering how you're going to help somebody and helping them expand their understanding of their worthiness outside of a physical body. We're going to get into that a little bit later as well. In diagnosing somebody with an eating disorder, I definitely encourage anybody in a position of diagnosing to make sure you have the time to talk about how the person feels about receiving that diagnosis. There's a lot of times denial that the eating disorder is even that severe, and to simply give a label of anorexia or any of the other eating disorder diagnoses without allowing a dialogue about, do you agree with this? How do you feel about it? Do you think it's that serious? Is really, really important, especially if we consider that a lot of times we're seeing codependent traits. And not only that, the difficulty in the power differential in any kind of relationship between a patient or client and a practitioner, a psychiatrist, a psychologist, so forth. So to make sure that you have the time to talk with them and almost pull for what is it like to get this diagnosis, and following that up with, make sure you understand that this is not all that you are, and having a very deliberate conversation to really control for, as best you can, the risk of them becoming too identified with anorexia. Part of the reason for that is because of the kind of unspoken, sometimes spoken, hierarchy of eating disorders that can even occur in treatment centers or support groups, where people just diagnosed with anorexia can be revered as kind of the top of the hierarchy, those with more discipline and so forth. So much so that someone seeking treatment for maybe bulimia or binge eating disorder will then begin telling themselves that they don't truly have an eating disorder, because only the truest of eating disorders is anorexia. So we want to make sure that we're being very open about that dynamic that's happening, and making sure that's discussed and talked about and cared for, because again, if they are not only identifying I am an anorexic, but now they take pride in it, now it's going to be even more difficult to change those behaviors, because it's even more entrenched in their identity. So we've been talking a lot about the body and the identification with the body, and the kind of dimensions of self that we're going to go through, I've borrowed from Ram Dass. He's a spiritual teacher that has written quite a lot of books about kind of developing a higher sense of self. And when we're young, kind of toddler age, we first discover that we even have a body, and it's kind of thrilling in a way. And you see toddlers looking at themselves in the mirror and things like that, and it's a kind of a novelty. And many people get stuck in thinking that this body, this is all that I am, this is who I am, and they don't move beyond that. And that can be very unfulfilling and dissatisfying, in a sense of, it's not quite right. I feel like there's something missing. And oftentimes when somebody has an eating disorder, that happens. It's the life doesn't feel quite full enough. So they come and see a therapist. And we give them a psychosocial understanding of themselves. We talk about co-occurring disorders and mood problems, and we also think about social factors like family and all of these different things. So now they have a broadened understanding of themselves. Well, I'm a body, and I also play this role in my family, and I also have this mood disturbance. And this is where the risk of over-identification with a diagnosis can happen. So it's important to either remind yourself or remind the people that you love or the people you're working with that they're more than a body, that they're more than a diagnosis, that they're more than the history that they've been through. And that's when we can move into a more kind of fun area, I would call it. And this is an archetypal understanding of the self. And this is also from Carl Jung. And archetypes are things like the healer and the warrior. And there's just lots and lots of archetypes. And the way that you can work with somebody or even kind of explore yourself is to look into what kind of heroes do I identify with. And this can be through movies or stories or fables. And you can also work with these in dream analysis as well. And this is even a deeper understanding of the self. So, well, I'm not just a body and I'm not just a diagnosis, but maybe I'm a warrior. And what does that mean and who I am and how I'd like to live my life? And then we can take it even a step deeper, and there's a big kind of almost spiritual revolution going on in psychology right now, where I'm seeing a lot more therapists integrating the spiritual element to their treatment programs, which is really wonderful, especially in terms of eating disorder treatment, and especially for somebody diagnosed with anorexia, because this even broadens out a more options, we'll say, on who I am and who am I as a spiritual person. And so again, we're moving further away from the body and down into a deeper and more meaningful understanding of the self. And pure awareness is kind of where we then take it. And this can be achieved through meditation or prayer, mindful living, and so on. And in pure awareness, you're able to be still with yourself and be comfortable with yourself and attend to how your inner world is responding to the outer world. And of course, this folds really nicely into the spiritual understanding of the self. And in pure awareness, there may be moments where you observe yourself identifying with the body and labeling your worth based on the appearance of the body. But in pure awareness, you're not necessarily attached to it. You're not caught up in it. It's almost as though you can watch the thought coming up, observing it, acknowledging it, and then letting it pass by. So sometimes these thoughts won't go away, but they become more manageable. And they can be observed and acknowledged and allowed to pass without any action being taken, because the person has developed a broadened understanding of themselves, where the appearance of the body is not the end of it. They can go, okay, I've had this thought, I'm telling myself this is where all my worth is, and now I can move forward and remind myself I'm a mother, I'm a father, I'm a daughter, I'm a warrior, I'm a healer. I'm a spiritual person connected with a power greater than myself, and I can sit in pure awareness and be present with that. To go into a little bit of what we do here at Rebecca's house in response to that, we have a phase system that actually mirrors these dimensions of self that Ram Dass talks about pretty well. And the discovery phase is the very first phase of our treatment. And when people come in, they're really discovering what it means to have a body and to care for their body. This is when we go through medical and psychiatric stabilization. Over the course of the years that I've worked with people with eating disorders, it's kind of shocking how detached from the body they can become. So much so that on multiple occasions, people will come in and have urinary tract infections, for example, and have not even had any clue that that was going on. So in the beginning, we help them kind of reattach to their body in a way and start caring for their body, discovering what it means to have a body. So we start there. And then the next phase is generating an awareness about oneself. This is also the psychosocial part of what we're doing. This is when we're delving a bit deeper into past traumas, the role in their family, different experiences they've had through their lives. When you talk with somebody with an eating disorder, oftentimes they have a kind of theory about how their eating disorder developed. And if you are currently struggling with an eating disorder, you may have a general sense of where it started and what might have been going on with it. And I just want to encourage you, if you are struggling, to share that with your treatment team and whomever you may be working with, because it's very valuable information. And so we develop an awareness and kind of build that out and understand, how did this happen? Oftentimes I describe it as driving in a car. And as you drive in a car, periodically you have to kind of look up into the rearview mirror. That's what this awareness is. You look up into the rearview mirror. You don't stay in the rearview mirror and driving around, because you'll crash your car. So it's really important that we periodically glance up and look back and go, oh yes, so that's what's behind me. But we don't stay there. We want to come back to the present moment. We also want to plan for the future, which we're going to get to in a little bit, but we don't just stare into the GPS that we've put into our phones or daydream about what you're going to do when you get there, because again, you would crash your car. Most of the attention is placed on the moment that's right in front of you, or the road just in front of your car. So through this awareness, we help people stay present, stay grounded, while glancing up into the past, pendulating into that pain, while staying grounded, because they've discovered what it means to inhabit their body. And that's the most important part. So systematically going into treatment through the self-discovery phase is really critical to make sure you're not exacerbating symptoms of post-traumatic stress disorder and keeping someone stuck in the past, because it's very terrifying for a lot of people to go into the past. So keeping an awareness of that the timing of when we do that work is really important. And in the discovery phase, when symptoms are really severe, that's not necessarily the time to be doing really deep work. So if you are struggling with an eating disorder, I encourage you to get help, get stabilized, and then begin to do the work that may address the underlying issues that's kind of fueling the eating disorder. The next step is taking action. And this is when we start getting more involved in things outside of ourselves, more involved in communities, taking this awareness, having an understanding of grounding skills, coping skills, and then going out into the world and practicing it. And part of taking action is being responsible and honoring your commitments. And so in planning action, we want to make sure that people aren't taking on too much that they can't handle, that the things that they commit to, that they can follow through with. And this is also a part of the higher understanding of the self, and being able to be honest with yourself about where you're at and what you're ready for, what you're ready to commit to, and not overextending yourself. With someone who does not have a sense of who they are in the world, or a sense of identity apart from another person, it can be very easy to overly extend the commitments that you make in an effort to please another person. So making sure that sometimes what I'll say is we want to back up, we want to slow down and really look at where the intentions are. What are the thoughts surrounding you taking on these responsibilities and taking these steps and living life in an intentional way that may be very different from the source of motivation from the past. So the source of motivation from the past may have been very external. I would like to please my mother, my father, my boss, my spouse. And what we are hoping to do through connecting with the body, understanding how the past is living on in your present, through looking back periodically and understanding how it's impacting your present moment. Then you're able to identify your values, and those values that you hold, not values that were handed to you by someone else along the way, but these are your values, and then you're able to take action based on your values. And this process can be exceptionally empowering in cultivating a true sense of self. Then when those responsibilities come along and the commitments come along, there's not the harbored resentments of I'm only doing this for this person, or if this is the person, no, my spouse is really putting a lot of pressure on me to do this. It's no, this is something that I am choosing to do. This is something that I want to do because I know who I am and where I'm going in life. And then finally, this is the stage of renewal. And these are all of the stages of our program that we do here. We are hoping to give a person a renewed sense of self so they can re-engage life from a perspective that's meaningful for them, and not necessarily in an effort to please someone else or do what they think they ought to do or should do. One of the things I find myself asking often is, well, I'll hear something, well, I really should get back to work. I really should go to school. And one of the things I say is, according to whom? Who's telling you that you should do this, you ought to do this, you ought to do that? And oftentimes they don't necessarily have an answer. And many times it may be that it's motivated to please someone else. So this renewed sense of life is energized and exciting and you're connected to yourself. And when you're connected to your true self, you're much better able to connect with those around you. So earlier I talked a bit about discovering the body and toddlers kind of beginning to understand that they have a body, and it's very exciting. But then if a trauma happens throughout the course of childhood, and it kind of it could be sexual trauma, it could be abuse, it could be neglect, it could be bullying, it could be any number of things. As a way of protecting oneself, people will sometimes detach from the body and even dissociate or kind of be in a different place than where the body is. And this is a very adaptive response to trauma. This is a way of keeping the mind safe and protecting the mind. Sometimes people will call it zoning out, which is a bit self-deprecating, but sometimes that this has become a pattern over time, especially with complex trauma. Complex trauma meaning multiple traumas happening simultaneously or never truly ending, where a person never really felt safe, so they're always on their guard. So you can imagine how difficult it would be to survive living in an unsafe environment, that the only way to really get by is to almost take a vacation from the body and leave it periodically. So another thing that can happen in the process of discovering the body is the process of starvation can make it very difficult to be present. Starvation impacts the mind and the body severely, and in the early stages of treatment, it can be very difficult to have people connecting with their body because their cognitive process or their ability to think clearly is very much impaired because their body doesn't have the fuel it needs to think clearly. So it's important, again, kind of going back to the last few slides we've talked about in terms of medical and psychiatric stabilization, is that we take the time to help people eat again, in essence, so their minds are better able to function, so their bodies have the resources available to be able to process the information that you're sharing with them. And one of the things to also keep in mind for people who are not familiar with eating disorders is the process of eating again can be exceptionally painful. There's a lot of gastrointestinal issues that can happen. Even the sensation of having food in the body is completely foreign. So this can really make the beginning stages of treatment difficult. And somebody struggling with anorexia, this pain may be so uncomfortable that they may have a hard time even trusting the person that's encouraging them to eat because they're having the pain. So it's important to know that we have to normalize that in a way and give them a heads up about that this is going to be uncomfortable, and give them the space to talk about that discomfort. And their self-worth may be unduly influenced by their weight and shape. So as soon as they start seeing weight gains, they may start feeling much worse before they start feeling better. And this is another thing that we want to address in individual therapy. And if you are a person struggling or you have love for someone who's struggling, just know that this is a really difficult time. And oftentimes people will struggle with some depression and while they're getting used to their new body. So it's really important to keep them in a place where they can talk about that. So a program with people who understand the process, who have gone through it, can help it seem a little less scary when they have the support of somebody who's been there. And that's simply something that a provider or a loved one cannot give. So support groups and having people around who have gone through it is really, really important. So the early treatment efforts that we talked about earlier also are a new way of living for somebody struggling with anorexia because they've been neglecting their body for so long. So the process of self-care can be kind of an interesting process for them because it's it almost feels a little bit strange to go to the dentist because you have a toothache, for example. And so when you're working with somebody in early recovery, especially if they're in a treatment center, if they're expressing interest in caring for their body, wanting to get a checkup or their teeth cleaned or so forth, I would say that that's a great idea, obviously within the context of sometimes it's not the right time for a number of different reasons. But the more we can reinforce a person caring for their body and doing things to take care of themselves, I would say the better. And so now we get into the awareness of the psychosocial influences, and this is in the discovery phase, or excuse me, this is in the awareness phase that we have here at Rebecca's house. This is when we start looking into the different family dynamics that may have played a part. one of the things that I like to explore is, how was criticism handed out? How was punishment dealt with? How would your family deal with failure? How about forgiveness? Were you continuously reminded of your errors, or was your family able to forgive and forget? And this is when people aren't forgiven for their errors and they're kind of beat up about any mistake that they've made, they oftentimes will internalize that kind of dialogue and will begin speaking to themselves that way. And this is what can happen, or this can lead to the problems with how they view their body, and that it's never good enough because maybe they were never good enough as a child. So in making sure that we take the time to acknowledge successes, and when we forgive people, to truly forgive people and allow them to move on rather than continuously bringing up past errors. Social influence is another really important thing to consider, especially in schools and so on. Several of the folks that I've worked with over the years have talked about social circles in high school in which groups of people will get together and not just high school, but also in college, and teach one another eating disorder behaviors. So oftentimes I hear stories about, purging with friends, compulsively exercising with a girlfriend or a boyfriend. So these kinds of social influences definitely need to be taken into account, as well as the pressure in social situations and pressure to perform or engage and so on. And if somebody is hypercritical of themselves and their self-worth is based on their body, they may not even seek out social supports because they're too embarrassed to even leave the house. Trauma definitely being a factor in a lot of eating disorders, and we want to make sure that we're very conscious of that and not necessarily delving into trauma work prior to stabilizing an individual and helping them build the coping skills to deal with the distress that inevitably comes up through trauma processing. One of the things that can happen when somebody enters into treatment is they may be very, very eager to address the underlying issues that are fueling an eating disorder, and it's up to the practitioner to pace them and make sure that they're not taking on too much too quickly, because that could be really detrimental to their safety. So making sure you have somebody stabilized medically and psychiatrically, and also that they have the coping skills they need to deal with the distress that will be evoked when trauma work begins. Also looking into co-occurring medical and psychiatric problems. This one of the things in terms of medical problems that we want to think about is this person, let's say, binge eating, for example, but maybe they have some kind of nutritional deficiency. So we want to make sure that we're looking at blood work and making sure that any other medical problems that might be creating eating disorder behavior are addressed first. So for example, I had someone that I was working with that wasn't really presenting with the cognitive or thinking patterns of somebody with anorexia, yet they were severely underweight. And upon going on to an interview, I discovered that he had multiple gastric problems and his body was not absorbing nutrients in the way that it needed to in order for him to sustain his weight. So these are the kinds of things that we want to be really careful about, because we don't want to pathologize somebody or give them an eating disorder diagnosis if the low weight or the problems that they're facing or the disordered eating that's being observed can be better explained by a medical problem. Same thing with psychiatric problems. Sometimes substance use disorders, for example, when somebody has a severe stimulant addiction, stimulants suppressing the appetite, they may get very underweight. They may be presenting as though they have an eating disorder, but in the absence of the substance and after they are allowed to regain the weight that they lost in the course of their substance use disorder, we don't really see necessarily that they have an eating disorder. So making sure that we're not too quick to diagnose and too quick to assume that a person has an eating disorder when it could be better explained by a different psychiatric problem. Also thinking about current life stressors. This is another important part in terms of grief and loss, stress at work. I've worked with several people that what we call kind of a subclinical eating disorder, so they don't necessarily meet full criteria for an eating disorder, but there's some traits and things that are going on. When that happens, this is a great opportunity for practitioners to provide education for that person and help them understand that they're kind of flirting with an eating disorder, so to speak, and that if they continue in the manner that they're living, that they could be risking their lives in essence, because anorexia, bulimia, and so on, these are life-threatening mental disorders. So we want to be providing education to people who maybe they're not there yet, but don't be afraid to have the conversation. This could be somebody who is maybe struggling as a workaholic, and they never eat breakfast because they're just hurrying up getting to work, and then they skip lunch, and because it's just too busy, can't get away from the desk, and maybe they only eat dinner. So now we're looking at restricting behavior, which is likely going to result in weight loss, even if they don't have necessarily the cognitive or thinking patterns around weight loss and self-worth with weight. This is still flirting around in a dangerous area. So we want to be really careful and make sure that we're giving people education as needed. And this is when having a dietitian involved can be really, really helpful. So archetypal action. So one of my favorite areas to do work in, because it's fun and people enjoy it, and you get to integrate stories and heroes and all sorts of interesting things and dream analysis. This is a really fun way of exploring who you are and who you want to be. And oftentimes in psychotherapy, we are talking a lot about problems because people are coming to us with a problem that they would like solved. However, we want to make sure that we don't take the fun and the zest out of life and knowing oneself. So this is a nice way of kind of rounding out treatment a bit. So when we look at the work of Carl Jung, one of the things I found in preparing for this presentation and I loved is he talks about how there's a psychic birth. And this is when the child starts to differentiate themselves from the parents and start to understand themselves as a separate entity. Oftentimes when somebody's struggling with anorexia, that differentiation has not happened. Many of the folks I've worked with, men and women alike, when I talk with them about, do you feel like an adult, and ask them that question, or have you ever truly felt like, yes, I am a man now, or I'm a woman now? Many times the answer is no. Frequently they feel under 16 years old or even younger than that, depending on what's gone on in their lives. So part of what needs to happen throughout the treatment process is we almost need to facilitate this psychic birth and when they're differentiating themselves from the parents. And this is when family work is really, really important, because the family systems or the family dynamic may have been part of the problem and not creating enough space for a person to become who they truly are. And oftentimes this is done out of love. This is done out of caring. A parent that wants to make sure that their child is not endangered or never wants for anything. But this kind of parenting can sometimes stifle a child's growth. So it's important that we help the parents understand how to safely give a person enough space where they can become who they truly are. And when we look at inner child work, this can really help a person grow and mature and understand a better part of themselves. Some of the things that I'll do in practice is look at the type of attire that people are wearing, the tone of voice that they take when they're speaking, because oftentimes the age that they feel, they really personify that, they really take that on. I've worked with many people who still wear children's clothing, partly because of the size and the weight that they're at, but partly just because they don't feel like an adult, and it feels awkward for them to even buy adults' clothing. So being in touch with that and recognizing when a person is still feeling like a child can guide the treatment process and help them grow and become a more mature self. Some of the things I'll do is talk about, have people repeat back things that they had just said in a different tone of voice that matches their age better, or encourage them to maybe try to dress differently one day for one of our sessions. Like, do you think that you could try to dress as the age that you are rather than the age that you feel, and just see how it goes? And this could present a number of different problems, because they may simply not have the clothing that they need. And shopping is something that we also want to be very careful about. The first shopping trip of somebody who has maybe grown out of the clothes that they wore in the throes of anorexia, they're likely going to need some support throughout that shopping trip, because that is a very important moment for them. And we want to make sure they have the support that they need to make those purchases, and also have a therapy session either that same day or shortly thereafter to process what that was like for them. And the idea of generating personal values and kind of coming back to heroes and heroines, a lot of times I'll ask people about their favorite movies growing up, or what their favorite movie is now, or what kind of a hero that they identify with. And then we get to explore what the values of that hero are, what they like about that hero. And oftentimes, I think a lot of people have had the experience where they're able to give advice to someone else, but they're not able to give that advice to themselves. So when you can externalize a part of the self by having them go through and talk about a hero rather than themselves. So instead of what are your values, what's your hero's value, or what's your role model's value? What are the things they live by? And sometimes that's easier for them to talk about rather than talking about themselves. And so that's a kind of a neat way for them to then identify those values and find a way to live that will give them that meaning that they're looking for. And in having those role models, it can really guide the action that they take in their life. And we want to make sure that they're living in a way that can build confidence and develop a new sense of identity. And sometimes taking on the values of a hero can even imply a kind of gained strength that can come along with it. I worked with someone a while ago that what we ended up doing was integrating art, and this person was very interested in wolves, and so she drew out multiple wolves like a wolf pack, and each wolf had a superpower. And as we explored this more and more together, each of these wolves were a component of herself. And by using these wolves in our therapy session, she was able to tap into how different wolves would handle different situations, and we were able to identify like which one would be the best for this particular circumstance, and what might they do to deal with this certain problem. So it's kind of an interesting way to kind of almost come in through the back door, so we can talk about things that are difficult to talk about when hit head on. So I just want to encourage anybody who's doing practice to really look into what the people that you're working with, what their strengths are. If they are artistic, bringing the art in and using that to their advantage. The spiritual self. So one of the things we have to assess for in terms of a spiritual self is, of course, a spiritual history. And getting someone involved in your treatment team that really specializes in spirituality can be fantastic. There's different spiritual assessments that a person can do to kind of understand which spiritual or even religious path is best suited for them based on the values that they already hold. And one thing that's interesting and helpful about religion and spirituality is the kind of moral framework that it provides. And in the search for values, it can be kind of difficult to even say, well, what are my values? I've led countless values groups with people with various diagnoses, and it's a tough group. You know, when you ask a group of people, what are your values? They'll come up with a couple, but people kind of get stumped on it a little bit. So the more that you can bring in external material, heroes with their values, but also, well, what kind of spiritual and religious affiliations do you have, and what kind of values do they follow? Is this something that you identify with? Is there parts of it you agree with and parts of it you disagree with? So these are different ways of being creative and helping them identify who they are and what parts of spiritual and religious organizations they identify with. And with anorexia being worshipped as a higher power, this is when the 12-step programs can be pretty helpful. Eating Disorders Anonymous and also Overeaters Anonymous and their step work can help people understand if they've gone there. Sometimes the knee-jerk reaction of have you worshipped anorexia as your higher power can oftentimes be no, because it's kind of a loaded question in a way. So we want to be careful about how that question is framed, because we don't want that to be shoved away. Rather, asking open-ended questions or asking people to consider it. Is there any ways that you've worshipped it or it's become the center of your life? Sometimes people just immediately say, yes, absolutely. But some others may need you to tread a bit more lightly around that question. And part of the struggle in working with somebody with anorexia is the kind of tunnel vision that they get. And the tunnel vision tends to go in on the eating disorder behaviors, not just with anorexia, but when we look at the effects of starvation, this is very pronounced with anorexia. So this tunnel vision can kind of come in and just hone in on the behaviors, where this is where all the focus is, all the time and attention is spent on anorexia. So then it almost just becomes a way of life. And these can be really time-consuming disorders. So we want to make sure that we honor that and help them explore, how much time were you spending on it? How has this affected your relationships and disconnected you from people? Just prior to recording this, I was just doing a gratitude group with a few people, and one person struggling with anorexia was able to identify just how disconnected it can make a person feel. So, and the group talked very much about the importance of reconnecting. And so the connection can be really important, and not just an individual's spiritual self or religious affiliations. It's also the community that surrounds these types of, the organizations that surround these types of practices. So not only is it a personal practice, it's an opportunity for a person to join in and connect to other people in a meaningful way with shared values and shared beliefs, which can create long-lasting friendships and support that is imperative in long-term eating disorder recovery. And by helping people get a spiritual self, that tunnel vision kind of lifts their gaze. If you've ever worked with or been near somebody who's really in the throes of anorexia, oftentimes they'll be hunched over, they won't be making a lot of eye contact, the responses that they give may be mumbled, it's difficult for them to communicate. Many times they'll develop something called apraxia, or the difficulty identifying a feeling, and that makes communication exceptionally difficult if you have no idea what it is that you're feeling. And so they tend to kind of retreat within and be almost hunched over in it. So when we help them connect with something outside of their self, it's almost like lifting their gaze and opening their eyes to more possibilities in life. And not just more possibilities in terms of opportunity, but more possibilities in who they might become. So when we look at responsibility and commitment, and just kind of segueing from spirituality, that kind of moral framework I was talking about can help provide that action. And also the spiritual community is providing that support that they may need. And when a person is able to identify what they value, connect with a group of people that help reinforce those values, not necessarily telling them how they ought to live and what they ought to value, but just being with people who are like-minded and giving you validation and feedback on how you're living, speaking from the perspective of somebody struggling with anorexia, this can begin to enhance self-esteem and self-worth and personal value, which is obviously very important for somebody struggling with anorexia, especially when they feel that their anorexia is almost being ripped away from them and that they have nothing left. We want to make sure that we are giving them something else. And when they begin to take action on these values, that's what we're giving them, because one of the reasons why I love helping people with eating disorders is the moments where they feel connected, when their gaze does lift, when they get reinforced for doing the things that feel good in life, when they live a life that they can feel proud of, that they want to share about, and they're excited to live and be alive and take care of themselves. Sure, that eating disorder voice may still be lingering in the background, but when they've transitioned, there's kind of a process where the eating disorder self quiets down while the truer self becomes louder. And there's this point, there's usually a bit of a plateau where they're at odds. You know, the eating disorder self and the healthy self are kind of going back and forth, and they'll do this for a while, and then eventually that true self gets a bit louder, and then we start seeing the true self more and more often. And I don't know that I've ever experienced something so rewarding in the course of my career as when that moment happens, when we push past that point and they're able to be in their true self more frequently. It's one of the most beautiful experiences I've had. And when we have a structured daily routine, that is all about taking care of yourself and being connected and living a life that feels good, this can take away a lot of distress. One of the things that happens in treatment is when people come in, there's a lot of internal chaos. Life feels completely out of control and out of hand. And when there's a lot of internal chaos, we want to make sure there's a lot of external structure, because what that structure does is it helps relieve the distress of even making a decision. One of the things that can happen when you go to eating disorder treatment, especially inpatient hospitalization, is the bathroom will be locked. I've worked in facilities where this was an intervention we used frequently, and you would think, oh gosh, you know, it's very inconvenient to have people come unlock my bathroom, and of course there's some shame and embarrassment around having to have this intervention. But oftentimes, when we take that step and help them make that decision that that's what needs to happen to keep them safe, their anxiety and distress markedly decreases afterward, because now it's just off the table and they don't have to think about it. That's what committing to a daily routine can do. I get up, I have my breakfast, I take a shower, I go to work, and this is what I do. And when you have that commitment to a daily routine, it can really decrease the stress. For another example, so let's come back to the bathroom lock. My goal for anybody who needs that kind of an intervention would be to eventually not have the bathroom locked. And then when you're struggling, to be able to use your voice to ask somebody who you know is supportive to either be with you or maybe even ask you to stay out of the bathroom or keep the door cracked or so on. So it's not the externalized structure that's helping the person control their behavior. It's coming from within. It's, oh, you know what? I just had a really stressful day at work. I just ate a meal that was really, really challenging for me. I don't know that I'm safe to go into my bathroom, so I'm going to, and I really need to use the bathroom, so I'm going to ask somebody that I can trust to maybe stand outside of the bathroom while I sing a song, so they know that I'm not purging, just to hold me accountable. So understanding that sometimes we need to implement external support, and it's okay to ask for that. Renewal and pure awareness. So this is the idea of really being able to live in that state where you are a renewed person, you're engaged with the world, and you're able to attend to what's going on within you in response to what's going on outside of you. Not necessarily that you act on it, but you can recognize that it's happening and then make a decision. So this is a way of cultivating the true self, and being able to recognize the false self. And what I was talking about earlier is, you know, as the eating disorder voice gets lower, and that the healthy self, the true self, the spirit, the essence, whatever you'd like to call it, gets louder. This is when we can still hear and observe the eating disorder self, but it doesn't dictate and drive behavior. You can have, oh gosh, you know, my eating disorder self just came online there and told me that, you know, I need to really hit the gym harder today because I let myself have pizza for lunch. Interesting. And then setting that down and moving forward with your routine. Since we're on the topic of the gym right now, mindful exercising is definitely something that can work for some people, but we do want to make sure that somebody with anorexia is medically cleared by a physician and monitored by a dietitian, and as well as somebody who can help them learn how to exercise safely before that even happens. So if you are someone struggling with anorexia, please just exercise extreme caution when integrating exercise into your daily routine. So let's see here. So when we have this renewed sense of self and we're anchored in values, that you have identified through self-exploration, it'll be easier to make decisions. And one of the things that I've heard a lot about over the years and working with people struggling with various eating disorders is the difficulty making decisions. This can be markedly more difficult for somebody who has been starving themselves for prolonged periods of time because of the inability to think clearly. But similar to a type of therapy called acceptance commitment therapy, we accept that things happen sometimes. We commit to taking a valued action, and then you take that action based on those values. And this is kind of this similar of what I'm talking about. And oftentimes I'll use ACT or acceptance commitment therapy to help people make decisions. And if you can imagine, if a person who has developed their entire sense of self around anorexia, and they don't know what their values are, and all of their values have been driven by other people, potentially abusive people, it would be very difficult to make a decision. It'd be very difficult to make a choice for yourself, especially if you've been in a situation where you were controlled by someone who told you what to do and when to do it. So in the later stages of recovery, our hope here at Rebecca's House is to help people prepare themselves to know who they are, know what their values are, and approach the world with a renewed sense of self that's really prepared to make those decisions for what's best for you. And one of the hardest parts is being able to be still in that awareness, that pure awareness. Oftentimes, stillness can be very uncomfortable for people, and not just somebody with anorexia or an eating disorder, but people with a multitude of psychological disorders, or somebody who simply has no disorder whatsoever. In our culture today, where we are constantly stimulated, it's becoming increasingly difficult for just a typical person to sit down, be still, and be present. With phones and televisions and all sorts of different things, the internet, we're constantly distracted. So we never have to attend to kind of the default mode network or the train of thought that occurs when you stop doing and you just let yourself be. It's really important for anybody in treatment to be able to be bored. The ability to be okay with not being okay and just letting things be as they are in a moment can really help in times of having urges to go back to an eating disorder, when having urges to restrict. If you've been practicing being still and being okay with not being okay and observing your thoughts without necessarily taking action on them, but the ability to acknowledge that it's there, validate that you're having that feeling and understanding where it's coming from based on the work that you've done and looking into the past, it's going to be much easier for you to go, okay, I understand where this is coming from. This makes sense why I'm having this thought. And I can set this down, remind myself of my values, and then move forward. And when you're anticipating these events, when you know what types of situations or people or events are going to be upsetting, it's much easier to recover from this distress and from this upset and continue to move forward. So in conclusion, we want to acknowledge the extreme difficulty in helping somebody who's struggling with anorexia to form a true sense of self, depending on the severity of anorexia. In the beginning stages of treatment, this is nearly impossible to do, especially if a person is extremely starved. So allowing the adequate amount of time to pass in order to make sure that they are stabilized before doing this difficult work will not set them up. And keep in mind, not all, but many people with anorexia have a tendency toward perfectionism. So if you're working with somebody with anorexia and you start making demands on their progress in terms of understanding a higher sense of self before they've even restored their weight to a point where they can think clearly, you're setting them up for a failure. And this can be absolutely devastating to somebody with an eating disorder. So make sure that your pacing is taking that into account. Maintaining good boundaries with everyone that interacts with somebody with anorexia is also very important, so they know where the line is. And oftentimes when people understand, just people, not just people with anorexia, when they know where the lines are, it's calming. Having good boundaries is really, really important because it puts people's minds at ease. So it's not a question mark. And making sure that we take the time that it takes to develop a person's true sense of self, and take their age and the time spent in anorexia into account. If they've not known who they are ever, and now they're 40, you're going back and starting to help them develop a sense of self that they have not been connected to for potentially 30 years. So this is a long process that takes time, compassion, and patience. There are lots of different ways to explore yourself, and we talked a lot about those today. How you relate to your body, what you've been through, how you think, what you relate to, people, stories, heroes, who you are as a spiritual person, your understanding of that, and also as a self that can observe your life as it passes. So there's lots of ways of exploring yourself. We are all more than a body, or what I like to call my earth suit. I'm much more than an earth suit. My body gets me from point A to point B, and I'm very grateful to have it, and I want to take care of it, much like I would take care of a vehicle, but it is absolutely not all that I am. And I hope that all of you are able to recognize that as well, that you have so much more to offer the world than your body, and I hope that you will allow yourself to explore who you truly are beyond the skin you're in. Thank you so much for your time and attention.
Thank you for an excellent presentation, Nicole. That was so interesting. I think
Thank you.
helpful to everyone, both our professionals attending, these individuals struggling with eating disorders, particularly anorexia, and the family members. And I wanted to also point out that Nicole has generously shared a PDF of this presentation that anyone can download if you want to have notes from this. We also put some information in the chat section about Rebecca's house, where she is the lead therapist. So check out Rebecca's house. They're wonderful. We want to thank Rebecca's house also for being a generous sponsor of this conference, which helps us do this kind of work all over the world online. So lastly, I know what I want to say lastly, thank you for your service to our country very much.
You're very welcome. Thank you.
All right, and with that, Nicole, we hope you have a great rest of your day, and we really appreciate your time.
Thank you for having me. I appreciate the opportunity to speak with everyone.
Take care. Bye.